organizations. And so I was really interested in this because I feel like I've seen resources, a lot of resources and work at higher executive levels and at frontline levels, but you know, like managers are just so important. And so I was really curious about what tools were available and yeah, and how, you know, in my work, how can I help folks at manager levels think about what their role is in change and what their role is in being sort of this, you know, I don't think we talk about the hierarchy in our organizations enough and how that impacts change processes. And so I was really interested to check this out. I'm also working on my master's in health equity organizational change, and so that's kind of my other hat. But yeah.
Thanks, Alia. Thanks. The meat or the peanut butter in the sandwich is often how middle managers or middle management is referred to. So thank you. Thanks for that. Jeremy?
Yeah, my name is Jeremy. I'm the Executive Director of the French Language Health Network in Nunavut. So I live on the Nunavut territory. It's good to see you today. So we worked through the Official Languages Action Plan for the Francophone minority, but we strongly believe in equity here, and there's a lot to do about equity to healthcare system and primary care for the linguistic community here, which means or includes Inuktitut, Inuit Actum, and French people. So, hi everyone.
Hi, Jeremy. Welcome. Lori?
Hi, everyone. I'm a director here at Algoma Public Health, which is in Sault Ste. Marie, way up north, Northern Ontario. And we are on the Batchewana and Garden River First Nations communities and the Ojibwe. So my role for the last 4 years has been leading health equity, primarily with the health equity nurses, or the social determinants of health nurses that were allocated to the public health units in Ontario. We are also developing health equity competencies right across the organization, and the middle management piece I think is critical to this for developing competencies at the staff level. Our middle managers are very, very deep in program planning, and having the skills to build health equity around their program planning work is critical. And also from a cultural perspective, we are looking at competencies and developing those in our staff and middle managers around Indigenous engagement and how they can use those engagement skills to move the planning that they need to do at their program levels. So how do we embed planning and health equity planning into the work that the managers are doing and giving them those tools to work with their staff?
Thanks, Lori, and that's excellent, and good on you for really excellent work in driving that agenda forward. This resource is just a very small part of that, but I think that way forward is a really important way forward. Nadine, and then Michael. Or Nadine, we already heard from you, right? You just flipped around on my screen. Okay, Michael.
I have a little friend in my background, so
okay.
COVID reality. But.
Yeah, COVID reality. There you go. Michael.
Hello, everybody. I apologize, my camera is not working today. And I'm a Master of Public Health and Nutrition and Dietetics student at the University of Toronto. And I also identify with living with disabilities. And I'm a huge advocate. I'm actually challenging a lot of U of T's policies right now regarding that. But my main goal is to work in public health. I really am trying to increase my knowledge base to maybe lead a team to help implement a national school food program across the country. There's lots of advocacy going on for that, so that's really my goal. But I really wanted to take this to learn potential management skills. I love working with people, and I think I could be a good leader, so I just wanted to learn some things about that.
Okay, great. Well, we have 2 students, so that's fabulous. Thank you, Michael, for introducing yourself. So I'm going to share my screen. and hopefully you can...
There's also, we've seen, sounds like we've missed Noelle.
Did I miss Noelle? I think my screen jumped around a bit. So Noelle, sorry about that. Did we? Noelle, were you able to speak?
It looks like we only have 8 on
Sorry,
now.
yeah, I'm here. It's just I was looking for the mute button.
No
Can you
worries.
hear me?
Yes, we can.
Okay, so I will join my colleague who is doing his master also to apologize. I'm not sure why my camera is not working. But anyway, so I'm finishing my master in public health, specialized in global health. And I'm actually pretty much interested in the topic of health equity, specifically with the unprivileged and minority people here in Canada and across the globe. Currently, I'm doing my research on opioids prescription and the use of this substance within the health equity system, precisely working with the at the community level. As for my interest towards this this part of the webinar, I have done my undergrad study with the HEC de Montréal in the management field of the healthcare system, and I look for eventually to work with teams on the health equity and advocacy eventually. So thank you for having me, and hello to all.
And do you say your name Noelle or Nawal? How do you say your name?
Yeah, the whichever, but the first option was good. It's Nawal.
Noelle, thank you. Thank you.
Thank you.
Okay, so I prepared a few slides and then I thought we would actually go to the resource for a little while. And it was interesting, I'd prepared these slides and for our conversation today, and somebody in the chat box said, who is a middle manager? And basically a middle manager would be defined as a director, a manager, a supervisor, and sometimes they manage a program. I think one of you here today is a manager more of a program, not necessarily of staff, but they often do supervise or support staff as well. So our perspective, and just from my own lived experience, I think that a middle manager, and there's many of us across the system, has a very, very important role to facilitate and support health equity work in public health organizations. A very critical role, actually, and probably an under-recognized and under-supported role in that work. And it's not easy work. And to do that work, and to do that work well, we felt that the middle managers really require some very specific health equity competence. So in other words, knowledge, skills, and attitudes. And the focus of this particular resource was to support professional development of middle managers. So not necessarily the tools that might be required by the middle manager to influence that system or to influence up, but actually to help the middle manager acquire the competence to do that. And I put there other work in this area because I'm wondering, and I'd like to come back to that in our conversation, are there other mechanisms, other things that could be put in place by us, by our sister centers, for example, the other collaborating centers, that would support middle managers and specifically kind of hone in on that particular staff group within our system. So middle manager, by definition, Wikipedia, is actually a manager that sits between senior and junior, or upper and lower sort of parts of a hierarchical organization. And in many public health organizations, we are very hierarchical, where we either are part of government, part of hierarchical organizations that very clearly have senior leadership and very clearly have lines of hierarchy. So it's a hard job. It's a very hard position to be in. It takes tremendous energy and tremendous, I think, self-reflection and I think self-care. And something that I wasn't always so good at, is actually looking after myself within that kind of pressure filled environment, because you're subordinate to, but you're also responsible for the performance and productivity of others, and then you're also subordinate too. So you tend to be a real communication conduit, but you also have an incredible amount of opportunity to influence up, because you're asked for your opinion, and also to be able to influence down, if you will, within a hierarchical organization, on staff, who then, of course, have that impact with the 5 minutes remaining. So we'll get there. So you do have that influence up and down, but I'm also going to say, and I hear from you, that influence sort of out and about. So as Pemma said, this particular learning pathway would take you at least 5 hours to complete. And I would suggest that you wouldn't want to do that in a row. Like, you might want to take 5 different sessions to actually work your way through the 5 different modules. It takes about an hour to review the core resources within each one of those modules. And then there are a whole variety of additional resources, some developed by the NCCDH and some developed by our collaborators and our partners. These 5 competency domains come from the Federal Public Service Competency Map, or competency set, if you will. And so generally what they're saying is that a middle manager generally would hold these competencies, and what our resource is doing is saying to create a vision and strategy, in particular about health equity, here are some things to review. To be able to mobilize people and achieve results, here are some learning activities and some things for that middle manager to do. Upholding integrity and respect, sort of being in that values environment, here are some activities to do, and onwards to partners and stakeholders, and then to promote innovation and guide change. So I'm going to move myself out of this particular resource and into the actual, there it is. So this is what it looks like. So if you Google, and I think the links are in the slides, but if you Google Learning Pathways for Public Health Managers, you will find this particular document. You can see there it's about 50 pages long, in both languages on our website. And it's something that we would encourage you to do, but it was very interesting today to see that nobody had actually used this particular tool in the polling that was done earlier today. And as Pemma kind of outlined, there's a self-assessment test, there's some resources to read, and some activities to do, and then there is a post-quiz, which is consists of 10 questions. The original vision for this is that it would be a lot more interactive and facilitated, but it is something that you would do on your own. So we only have a couple of minutes left, so that would introduce you to it. So here's create vision and strategy. You would start with what the competencies are. There's a quiz to take, a self-assessment quiz. The answers are right down here. And then some resources are Let's Talk, Health Equity, our Common Agenda for Public Health, etc. So before we move, because there's 2 minutes, I'm just going to open it back up to you. Is there any questions or any comments? Did anybody have a chance to look at this resource before we came into this room?
I have to admit, I was planning on participating in the racism session, and then I thought at the last minute, when I realized another colleague was participating in that as well, that I would switch it up and choose a different group. And I do foresee some of this being useful as we move forward dealing with the pandemic, and we're a recently amalgamated organization. with, you know, several new managers, I think I can see some of this being helpful.
Thanks, Amy. And you know, if you wanted to go through this, or if a team of yours, we're very interested in how this might help. You know, do we do it as a group? Do we build a network of managers? I kind of have a feeling myself that there are managers out there who might like to come together and perhaps start by working through some of this together, because it is a very unique place and space and role within those organizations. So any feedback, Amy, I'm wide open to, or any ideas about what we could do to support you. Any other comments? I'll just, you can see communicating, you can see this common agenda. And I think the richness here is it gives you some time boundaries, right? So if you were to do this particular resource, communicating about the social determinants of health, in particular income, inequality, and health, it would take you about 19 minutes or 20 minutes to read that particular document or to review it. But I think what, again, is helpful, here's the competencies for managers that would be addressed within that, and then there's the questions and activities that you would take away from that. And then there's a very rich list of additional resources and some ideas about how to use them. So I'm a group learner and a group thinker. So for me, I'd want to have somebody with me, review the resource, and then think about the questions and activities. Any other comments before they're going to move us out of here magically using Zoom back to the big room? Yes, Nadine.
I think this is really great. We're actually at the point where we're doing a bit of a needs assessment with teams in terms of what other supports they may need to, you know, sort of apply what they've learned with respect to cultural awareness training, and sort of changing the way that they work to be able to work effectively with our Indigenous partners. And I think this is really helpful to have like the competencies laid out in this way. And then even just some like actions and, you know, sort of like the additional activities to support learning in those areas. So I'll let you know. I really haven't, this is the first time I've looked at it, so I haven't had a chance to sit down and kind of work through it, but I'd love to keep in touch with you in terms of how we might apply this in our like needs assessment in our organization.
Okay, and so my email address is cbetker, CBETKER @stfx, so stfx.ca. I'll put it in the chat box in the big room.